Welcome back, everyone, to the Deep Dive. Today, we're tackling arthritis, something many of us know, but with a bit of a twist. We're focusing on two really amazing large animal groups, camelidae, so camels, llamas, alpacas, and cervidae, our deer species. And our goal here is to really dig into the research you shared, pull out the key takeaways, and help you grasp what arthritis looks like in these animals, plus some surprising differences and, why it all matters.
Exactly. And while arthritis itself might sound familiar, it's fascinating how it shows up and what it means varies so much. It really depends on the species, their environment. It's a great look at how basic biology plays out differently in the real world.
Okay, so let's start with the basics then. Arthritis, fundamentally, is inflammation in the joints, right?
That's the core of it, yes. Inflammation.
And what does that lead to for the animal,
Right.
practically speaking?
Pain, definitely. Lameness, difficulty walking, and just generally reduced mobility.
Which I imagine has huge knock-on effects, especially depending on where they live.
Oh, absolutely. We'll definitely get into that. Now, the research breaks arthritis down into a few main types. First, there's infectious arthritis, sometimes called septic arthritis,
Septic, okay.
like an infection.
Precisely. Caused by microorganisms, usually bacteria, getting into the joint. And this is often seen as a real orthopedic emergency.
An emergency. Because that infection, that inflammation, it can destroy cartilage and bone incredibly quickly, sometimes irreversibly. So fast action is key.
Got it. What's next?
Then we have degenerative joint disease, DJD. You probably know it better as osteoarthritis.
The wear and tear kind.
That's the one. It involves the slow, progressive breakdown of that protective joint cartilage, often linked to age, maybe old injuries, or even just how the animals built conformational issues that put extra stress on joints over time.
Makes sense. Are there others?
The sources mention a couple less common ones, yeah. Immune-mediated, where the body's own immune system attacks the joints, sort of by mistake. And traumatic arthritis, which is, well, directly from an injury, a heart impact or something.
Yeah. Okay. Interesting categories. But here's where I think it gets really fascinating, camels. How does arthritis actually affect them? The research mentioned different patterns based on age.
It does, and that's a key point. With camels, septic arthritis, that infectious type, is a big worry, especially in young ones, in calves.
White calves particularly.
Well, it often comes from infections elsewhere in the body that spread, or sometimes localized issues. There are specific bacteria we see. In calves, Mycoplasma species are a big one. It can cause just one swollen joint monoarthritis or pop up in several joints. Polyarthritis.
Mycoplasma.
Yeah. And we also see your usual suspects, like certain types of strep and staph bacteria. There's even one, Streptococcus egalactiae, found in calves, sometimes without an obvious wound, suggesting it might spread through the blood.
Wow. And in adults?
In adult camels, there's a particularly nasty one, Corynebacterium pseudotuberculosis. It can cause septic arthritis where the joints fill up with this thick, creamy pus.
Ugh. Sounds difficult to treat.
It really can be. The problem is these abscesses often form a really tough, fibrous capsule around themselves, like a wall.
So the medicine can't get in easily.
Exactly. Makes treatment very unrewarding sometimes.
Okay, that's septic arthritis. What about the wear and tear type, osteoarthritis, in camels?
Right, DJD. That's much more common in adult and older camels, very much linked to mechanical stress, maybe past injuries. And the joints most often hit are the high motion ones, the fetlocks, that's the metacarpophalangeal and metaharsophalangeal joints.
Fetlocks. Why those specifically?
Think about how a camel gets up. They rise from lying down, right? That puts immense stress on those particular joints.
I can picture that.
Yeah.
Wow.
We also see older camels with chronic lameness that seems to get worse in colder weather. And another interesting factor is poor foot conformation. Like if their toenails get overgrown, it changes how they stand and walk, putting abnormal stress everywhere, eventually leading to arthritis.
So even something like hoof care is crucial.
Absolutely. It shows how interconnected everything is in their biomechanics.
And the signs. How would you know a camel has arthritis? Is it obvious?
It can range, really. Mild cases might just show intermittent lameness, maybe a bit of stiffness, especially after they've been resting, reluctance to move.
Okay, subtle sometimes.
But in more moderate or severe cases, it's much clearer. Persistent lameness, obvious swelling in the joint, it might feel warm to the touch, and it's painful if you palpate it.
And long term.
If it becomes chronic, you can actually see the joint change shape become deformed. Muscle wasting atrophy around the joint is common too, and sometimes you can feel or even hear crepitus. That's like a grating or grinding sensation when the joint moves.
Right, the cartilage is gone.
Exactly. And don't forget, if it's infectious or immune-mediated, you might see whole-body signs too: fever, lethargy, not wanting to eat.
And in those severe calf cases you mentioned.
Sadly, yes, they might be completely unable to stand, just recumbent.
So, okay, you see some signs. How do you figure out exactly what's going on? What's the diagnostic process?
It's definitely a bit of detective work. Starts with a thorough clinical exam, of course. Watching how they walk, feeling the joints for heat and swelling, checking their range of motion.
Makes sense.
Then imaging is key. Radiography x-rays are crucial. They let us see changes in the bone, like bony spurs called osteophytes, or if the space within the joint has narrowed, gives a picture of the damage.
Okay, x-rays. What else?
A really important tool, especially if you suspect septic arthritis, is arthrocentesis. That's a joint tap.
Taking fluid out of the joint.
Exactly. We analyze the synovial fluid. In an infected joint, it often looks cloudy, maybe discolored. Lab tests will show way more inflammatory cells and protein than normal.
And you can test that fluid for bacteria.
Absolutely. Culture and sensitivity testing is vital. It tells us which bacteria are causing the problem and which antibiotics are likely to work best.
That seems critical for the septic cases.
It is, and sometimes we might use ultrasound to help guide the needle accurately when we're doing the joint tap.
Okay, a multi-pronged approach to diagnosis. So once you know what you're dealing with, what are the options? What can actually be done for these camels?
Right. Treatment. It really has to be tailored to the type and severity. For managing pain and inflammation, especially with osteoarthritis, NSAIDs are the first line.
Like anti-inflammatories?
Yep, non-steroidal anti-inflammatories. Things like meloxicam or flunixin. For those immune-mediated cases, sometimes corticosteroids are used, but you have to be really careful if there's any chance of infection.
Because steroids suppress the immune system, right?
Precisely. And for the bacterial infections, targeted antibiotics are essential. Sometimes they use long-acting formulations like certain oxytetracyclines.
What about physically cleaning out the joint for septic cases?
Good point. Joint lavage, basically flushing the joint with sterile fluids, is really important in septic arthritis. Helps wash out bacteria and debris.
And general supportive care.
Crucial. Things like physical therapy, controlled exercise routines, managing their weight so there's less stress on the joints, and maybe joint supplements.
Like glucosamine?
Glucosamine, chondroitin, those sorts of things. And what's quite exciting is some newer stuff being researched for camels.
Like what?
Early days, but there's research into autologous cytokine-rich serum, ACRS. It uses the camel's own blood components to try and calm inflammation and promote healing within the joint.
Using its own body to heal itself, essentially.
Sort of, yeah. And even some work looking into camel placenta extract for potentially regenerating cartilage.
Wow, quite advanced. And prevention.
Basics, really. Good hygiene, especially during any veterinary procedures. Proper nutrition and weight management are key. And just being vigilant, catching problems early always helps.
That's a surprisingly sophisticated toolkit for camels. It really highlights the level of care in managed situations. But that makes me wonder, what about deer? When you move out of that managed setting into the wild, does arthritis tell a totally different story?
It absolutely does. The context, the implications, they shift dramatically. In deer, especially older ones, osteoarthritis is definitely seen. You find those bony growths, exostoses, and lipping on their vertebrae and limb joint.
Okay, similar pathology.
Similar underlying pathology, yes. But here's the crucial question. What happens when a wild animal gets severe arthritis?
Yeah. What does happen?
Well, this is where the ecological impact becomes stark. In a wild ecosystem, severe osteoarthritis, it can effectively be a death sentence.
A death sentence. That sounds harsh.
Think about it. A deer relies on its agility, its speed. If it's lame, if movement is painful and difficult.
It can't escape predators. Can't find food as easily.
Exactly. It becomes vulnerable.
Yeah.
Studies, like those looking at wolf-moose interactions, have shown that predators preferentially target older animals, and often those showing signs of arthritis or other weaknesses.
So nature kind of selects against it.
It strongly suggests that, yes, natural selection acts against individuals debilitated by conditions like severe arthritis. Genes predisposing animals to it are less likely to be passed on in those wild settings.
That's a powerful thought. What about infectious arthritis in deer? Are there specific culprits there too?
There are. One that's concerning is Mycoplasma bovis. Now, this is primarily known as a cattle pathogen,
Right.
but it's been emerging as a cause of serious pneumonia and polyarthritis in other wild-hoofed animals like bison and pronghorn. And significantly, it has been documented in both captive and wild white-tailed deer and mule deer, so it's a definite threat.
Any others?
Brucella species can also cause arthritis in deer, but there's a really crucial point to make about Lyme disease.
Ah, Lyme. Everyone thinks of deer and Lyme disease.
They do. And deer are absolutely critical hosts for the deer ticks that transmit the Lyme bacterium, Borrelia burgdorferi, no question.
Huh?
But the deer themselves are considered dead-end hosts for the bacteria. This means they don't typically get sick from it.
So deer don't usually get Lyme disease symptoms, including the arthritis.
Correct. They generally don't show clinical signs of Lyme disease, and that includes the characteristic arthritis we see in humans and dogs. That's a really important distinction.
Okay, good clarification. So if a deer does have arthritis, what signs would you see?
Similar to camels?
Largely similar, yes. Lameness, joint swelling, stiffness, signs of pain. But there's an interesting factor in farmed deer specifically.
Oh.
High carbohydrate diets, which are sometimes used in farming, can actually lead to laminitis.
Inflammation in the hooves.
Yes, painful inflammation in the hoof tissues. That, along with overgrown hooves, which can also result, puts abnormal stress on their joints.
Predisposing them to arthritis. So diet plays a role, too, in that context.
It certainly can, yeah.
And diagnosis in deer. Same methods.
Pretty much the same toolkit. Physical exam, lameness evaluation, x-rays are standard. And if you suspect an infection, that joint tap, arthrocentesis, and fluid analysis are key.
And what about managing it? Can you treat deer?
Well, for farmed or captive deer, yes, treatment often follows protocols used for other livestock. So NSAIDs for pain, maybe joint supplements for osteoarthritis, lifestyle tweaks like better footing.
And for septic arthritis.
Aggressive treatment, antibiotics, potentially flushing the joint or even surgical drainage if needed.
But for wild deer?
For wild deer, the story is completely different. Treatment just isn't feasible, realistically.
Right.
An animal with significant arthritis, significant lameness, is severely compromised out there. Its ability to find food, escape predators, even reproduce. It's all drastically reduced.
So it really impacts their survival chances.
Profoundly negative impact, which leads back to that strong negative selection pressure we talked about. It weeds out individuals who can't cope. In fact, finding a high prevalence of skeletal issues in a wild population might even hint at other underlying problems, like maybe inbreeding in small, isolated groups.
That's interesting. So we kind of pull this all together. We see the same basic disease processes, right? Inflammation, degeneration. That's common ground between camels and deer.
Absolutely. The fundamental biology of joint disease is there in both.
But the differences are really striking.
They really are. You've got different specific bugs causing infections, like the mycoplasma issues in camel calves versus Mycoplasma bovis emerging in deer. You have those specific joints in camels, the fetlocks, being prone to osteoarthritis because of how they move. That's quite unique.
And the biggest difference seems to be the outcome, depending on the environment.
Without a doubt. The implications for a managed animal like a camel or a farmed deer where there's potential for treatment and care versus a wild deer, it's night and day. That role of natural selection acting so strongly on wild deer with arthritis is probably the most dramatic contrast.
And that really gives you that aha moment, doesn't it? How much the environment shapes everything. Not just if an animal gets arthritis or what kind, but what it ultimately means for its life, its survival.
It's a perfect illustration of that interplay. Biology, behavior, ecology, it's all connected. The managed setting buffers the animal. The wild setting exposes it to the full force of natural selection.
It really puts the disease in a much broader context.
Yeah, when you study something like arthritis across diverse species like this, from the tough camel to the wild deer, you learn so much more than just veterinary details. You start to see the bigger picture, this intricate dance between physiology, behavior, the environment, and even those evolutionary forces shaping species over millennia.
So thinking about all this, what really stands out to you from our deep dive today? Maybe consider how looking at disease in wild animals gives us this unique, almost unfiltered view of ecological pressures and the harsh realities of survival. It's something we don't often think about when we just hear the term joint pain, is it?